Okay, so welcome everyone. I am Dr. Katrina Cryder, chiropractor here at A Touch of Health, and today we're going to start a new interview series, which I'm very excited about. And the first person that we are going to interview is my very good friend, Dr. Amanda Holt Shipley. She is a pelvic floor physical therapist, and we have known each other for, I want to say it's about 7 years.
No, it's got to be longer than that.
It's longer than that? Okay.
Oh, yeah.
It might be like 8 or 9.
We've had 10? How long have you had your practice?
10.
Oh, yeah. I knew you when you were at the old space.
Oh, that's right.
Yes.
So we go
like
way back.
Yeah, so like 12 years easily.
Yes. We have been through it all. We knew each other before we were moms.
Yeah.
And when we were just like, physical therapist, chiropractor. Now we wear many different hats. So I'm so excited to have you here today. So why don't you tell me a little bit about yourself?
Okay. And I just think it's fitting because you were my first podcast guest. So I feel honored to be your first interview with this endeavor. So yeah, my name is Amanda Shipley, and I live in Atlanta, Georgia with my husband, Doug, and our 2 daughters. So Len is 4.5 years old, and Annika is 3 months old. So she was just born. We welcomed her into the world amidst the pandemic. So we're getting used to life as a family of 4 right now. And yeah, I'm a physical therapist. And I started in orthopedics and loved it, but quickly found my way into pelvic health and really loved that. And when I moved to Atlanta, I worked for a large corporation for, like 11 years, and worked my way up the chain and directed clinics and ran their pelvic program for Georgia. And just really what makes my heart sing is prevention. And Katrina, I know you can relate to this. We practice medicine in order to promote wellness and to promote us feeling our best and being our best, not just trying to get rid of the disease or absence of not feeling good. So I really wanted to practice more in line with that, like with prevention and wellness. And so I went out on my own 3 years ago, 2017, when Solène was just a year old, and have never looked back. So I own Renew Pelvic Health in Candler Park.
I love it. So I kind of think of us as paradigm shifters, because what you and I talk about a lot is instilling in people that empowerment to take care of themselves now, unlike previous generations where they kind of wait until they're broken. So wouldn't you say your practice is more based on that?
Yes. So being proactive, and not just reactive. Yeah.
What made you interested? Like, you started in orthopedics, but like, how did you even find like pelvic floor PT, and what made you think this is what I want to do?
Yes. So I remember it was during my last rotation. So after, PT school, you have to do like a clinical rotation, like a doctor. And it was in my big practicum, the big rotation that I had, there was a pelvic PT there, and I did not have any experience with it. I really don't even think they mentioned it. We didn't learn about the pelvic floor that I remember in grad school. And I remember meeting her and being so impressed with her that she was comfortable with uncomfortable things. And I never even sat in on a treatment with her, but I did get the opportunity to learn from her and attend some of these classes that she held. And I remember when she taught, she said that, there's a proper position to poop, and my mind was blown. And I'm like, what? Like, PTs know these things?
Wrong?
Yes. I'm like, are you kidding me? Like, no, I've never, here I was like in my early 20s, I think at that point, mid 20s, I think. And I was like, what? How come I've never even heard this, And so I was really intrigued. And I remember thinking back then that I was still like a newbie, I would like get nervous if someone farted, or like giggle. And, it's just kind of, I was like, no, I think I need to, and I wanted to learn the whole body. I wanted to get good with treating everything. But it always was in the back of my mind, like, I want to get back to that. I want to learn about that, like that. And just in my practice, I ended up really enjoying working with people who had issues with their back, with their hips, with their sacrum, more than, you know, cracking necks or not cracking, but, you know, like just working with their neck or their fingers or their toes or their feet, you know, and I just kind of like gravitated toward that part of the body and got really good with it. And I remember it was a course, I took a course that was just an external course. And so I was in this course all weekend with other PTs on how to work with pregnant patients. And so, and I was just an orthopedic therapist at that time, but I was working with all these pelvic health specialists, and I would just, you know, after a weekend of like picking their brain and talking to them, I'm like, yeah, I'm ready. I was about 5 years out of grad school at that point, and I said, okay, I think I'm mature enough, and I just, you know, my passion, I just kept wanting to go back to that. So
for those that don't know, because I feel like this is like a newer specialty that's just cropped up probably in the time that you and I have been in practice. It's gained popularity, but there are some people who really aren't familiar with it. So what exactly is, first of all, what's your pelvic floor? And then what is pelvic floor PT?
Yeah. Oh, and I think, I have my pelvic model here if you want me to show.
Yes.
Hold on 1 second. Again, in the land of you know, COVID now with telehealth, I forgot I have an extra pelvic model here at home. So pelvic floor is the muscles, the joints, well, not really joints, but muscles, connective tissue, soft tissue, you know, like nerves, everything that basically is between your pubic bone in the front and your tailbone in the back. And the tailbone is the very base of it's like our vestigial tail, right? So the very bottom of the spine. And so you can see, like here, we've got superficial muscles that are more to the surface. And then this kind of shows the deeper, what we call the levator ani, which is that bowl at the bottom of your body.
So all the pink is muscles and connective tissue.
Correct. Yep. Connective tissue, muscles, fascia, ligaments, nerves. Nerves is a big thing. There are a lot of nerves down here too, which gives a sensation, right? So, but yeah, and then, you know, like your glute muscle is over this. So, but you can kind of palpate these guys from the outside a little better, the deeper ones better from the inside. So really, you know, we're standing up here, that is all muscle. That's just supporting everything from underneath, right? So, so that's the pelvic floor. Well, physical therapists are the movement experts, right? So we really focus on muscles and movement and getting you back to function, either getting you out of pain or helping you do what you used to be able to do and can't anymore, or taking your training to a higher level, say if they're working in a professional sport. So with a pelvic health therapist, what we do is not just work with that pelvic floor, we work with everything that kind of works with it. So the pelvic floor are trunk stabilizers. And what that means is they work with your abdominal muscles, with your diaphragm, with your back stabilizers. It's kind of like a whole, like, you know, your body works like a box, and we got 4 sides to that box. So, but truthfully, you know, your pelvic floor relates even to like your, the base of your head. And so there are some techniques I still do up in the neck that can help improve or make some positive changes with the pelvic floor. So we really do work with the whole body, but if you think of a pelvic specialist, they work kind of with the torso, pelvic floor. Also, we are trained to do internal exams. So that's a little different. When you go to PT school, we come out trained as generalists. So you can, you know, go work in a hospital in acute, say, you know, care. You could go work in a school. You could go work in outpatient orthopedics like I did. You could work in a nursing home. I mean, there's just a, you know, a neuro facility, people who've had stroke. So you kind of learn it all. But then after grad school, we take post-grad courses that teach us how to do internal exams. And it's not, there's no speculum used. It's just one glove fingers placed inside either vagina or anus to get to the muscles. We're not checking the cervix. We're not looking for organ, you know, we're just looking for the muscles and how they relate. We do, I mean, it relates to the organs, but we're not like searching for the organs.
Can you show the model again so we can see what you're talking about?
Yeah, so like your bladder sits right behind your pubic bone. So like we'll go in and we're in the vagina, but looking at all these muscles, palpating all these muscles, saying, is there tightness? Is there tenderness? And then with my finger right there, it's kind of like biofeedback. So I can say, okay, squeeze and hold it. And I can get a like an idea of how the intensity of your squeeze, how long can you hold it, how fast can you twitch, you know, those
right,
muscles.
and that just kind of gives you information on how those muscles are functioning so that you can determine what the issue is.
Right. Yep. So we can, you know, kind of diagnose, all right, hey, I think this is what's happening. Your muscles aren't relaxing, or, you know, your coordination is off if you've been hovering over the toilet for years and years and doing some things that are kind of messing stuff up, maybe, possibly. Yeah. Or, you know, if there's scar tissue or, you know, from, I mean, we work with like C-section scars, we work with, you know, all the abdominal surgeries, things like that. So, yeah. And then, so all the organs are in here. So once you get into pelvic health, you can't not be holistic. I mean, with orthopedics, they really, back in the day, at least when I went to school, they really were, you know, they teach us everything about muscles, but then how can you expect someone to get stronger if they're not eating well, if they're not sleeping, if they're not hydrating, you know, getting good, clean water and managing their stress? Yeah, all the stuff that you talk about in your Wellness Wednesdays, exactly. It's like you have to look at all that, right? Because you can't like not sleep, not eat well, go to PT, work really hard. I mean, your body, if you're not taking in good nutrients, you have nothing to like build more healthier tissue with, right? So especially when you get to this part of the body, the like what's going on with the rectum, like if you're constipated, that can totally make or break us, you know. Your bladder, if that's not happy, you know, that can affect your pelvic floor and vice versa. So we know that organs can talk to muscles, muscles talk to organs. So yeah, it's just so much fun. I mean, that's what I get to work with, you know, all the time.
So your model is a woman, but
yes,
we have pelvic floors too.
Exactly. Yes.
And there are certain issues that happen that they have that can be similar or different than what we have, right?
Correct. Yes. And really they have all the same muscles, but these superficial ones, so like this one that goes around the opening, you know, it's like farther up the penis. You know what I mean? Like, so it's just, they kind of look different.
Anatomy is like a little different.
Exactly. Exactly. So like the deep ones are pretty similar. It's the superficial that kind of like, they just have longer, you know, it's just not visually looking the same. But it's all the same muscles, literally. So they kind of have the, you know, the equivalent counterparts. And yep, and the same thing, they could have tightness there, they could have pain, they could have weakness. I will say then they do have different issues because you know, they don't have a gaping hole right in the bottom. It's kind of like if you were going to build a house, would you put like a hole in the middle where you are like walking over, you know what I mean? Like structurally it's not too sound, right? So you know, so we have this kind of like, not design flaw, but you know, I mean,
it's
like
just different design, so probably different issues crop up because of that.
We have to be on point, right? So that doesn't have an effect on things coming out and just falling out. You know, we have to have things just right. And so with them, they don't have that. They have a lot of more support there. So typically with men, it's more painful conditions, or if they've had cancer and they've had operations for, you know, prostate cancer, then yeah, you know, after surgery, they usually will have some leakage and things like that.
So can you answer the age-old question that I think has been normalized?
Yeah.
But is it normal for you to pee when you cough, when you laugh, when you sneeze, when you jump on a trampoline, whether you've had babies or didn't have babies? I think this is very common. Is this normal?
Absolutely not. And this is like a soapbox. I think probably I can speak for any pelvic PT out there, that we hear this all the time. Oh, you know, and it's passed down generations, right? It's like, oh, honey, you've had kids, especially if you've had like multiple children. They're like, I pee a little when I jump or sneeze or whatever. It's normal.
I pee a lot. Some people have that too.
Yeah. And it's like, no, it's not normal. And, you know, A, is not normal, and B, we don't have to deal with are the two big things, I would say. So common, maybe, right? Does it happen to a lot of people? Yes. And you know, I'd say if we're talking about, you know, even pregnancy, some people think, oh, it's normal to leak urine if I'm pregnant because I have all this extra weight on my body and stuff. No, I mean, there are many people who make it completely through pregnancy without leaking urine. But if you're going to have leaking a little bit during pregnancy, or that first 6 weeks postpartum where you're really just, you know, your body's kind of normalizing again. I mean, you're really normalizing for that first year postpartum, but that first 6 weeks, we kind of give people a pass. You know, if they're leaking clears up by that time, okay, cool. Your body kind of got back to normal. It was just a little hiccup in the road. But really, truly, even that is not normal. It's just, it can be common, and you know, healing, it's okay. But no, you know, you should be able to not leak urine with anything that you're doing. CrossFit, running marathons, yeah, laughing. I mean, lifting your baby, lifting anything, yeah. And truly, even if you've never had kids, like, I mean, it doesn't matter. I have people tell me all the time, oh yeah, well, I think I always leaked urine if I laughed really hard, like even in high school. And I'm like, no, that's not normal, you know. But like, were they empowered to say something, or no to say something, or to do something about it? You know?
No, because it's very normalized, right? So, oh, I do that too.
Yeah.
Right. And then it's kind of swept under the rug, which is why I love that pelvic floor PT has become so popular. And I think more people need to know about it, because I think goes on to my next question. Are there any other symptoms that have been normalized that you would say are not normal at all?
Yes, absolutely. So the first one I would say, because I've heard so many patients tell me this, like, well, I told my doctor, they didn't say anything. And like, you know, they would go to these big practices and they'd see every doctor in the practice, you know, for their pregnancy, 10, 20 doctors. I mean, like literally every single person in the practice. And they say, you know, sex hurts. It hurts when I have sex. Oh, just have a glass of wine. Oh, just, you know, I mean, literally, like, well, what if you don't drink? You have to be drunk to, you know, and, you know.
Yes, that's terrible.
Connect with your partner. I mean, it's insane. So I'd say painful intercourse is something that gets swept under the rug. And, you know, it's just like this, oh, it's normal to have, you know, pain with intercourse, and that's absolutely not true. And then the other thing I would say definitely is pain during pregnancy. I cannot count how many times people, you know, have told their practitioners and said, oh, you know, my back hurts, or my pubic bone, you know, my whole pelvis hurts, or my rib hurts, you know. And it's like, okay, well, you're stretching, things are getting bigger. It's like, okay, but is there something they can do about that? Like, yes, you know, and so, yeah, those are the two big ones.
Wouldn't you say another one would be, you don't have to go number 2 every day?
Oh, yes. Thank you. Yes.
That one is the one, like, if you eat every day, I'm like, how? Because
3 times a day.
Don't you feel that some issues are constipation, and we don't realize that we're constipated?
Totally. And so, because you know, back to that, like, you know, just even looking at our anatomy, just because physically, you know, the rectum, the bottom of the large intestine is right here, then you get your bladder, your uterus, and then pelvic floor. They're all so close together. I tell my patients, it's like they're nosy neighbors, right? So if one isn't happy, they all talk like chatty Cathy's, and then the rest of them aren't happy. So, if your bowels are backed up, and again, you're thinking, oh, once every 3, I was literally taught that in school, 3 times a day to once every 3 days is normal. I tell you, I would be so uncomfortable if I didn't poop until every 3rd day.
Same. I'm so cranky.
Yes. And so, and then, you know, if it's harder and coming out, just no. And so, so again, and it's interesting because the people that I work with, I know if they say, oh, once every 3 days is within normal, and I just immediately, I know, because all my crunchy holistic friends and colleagues, I mean, they're like, no, you've got to at least go once a day, at least once a day. Because yeah, if things are working and moving well, like that's really what we're shooting for. That's
and that's cool. The body needs to, you take nutrients in, and then you dispel what you don't need. And that needs to be an ongoing process. Otherwise, it's not good for the body.
Yes.
Okay, so I think what's been even more popular before pelvic PT was we need to do our Kegels.
Yes.
Right? So should we be doing Kegels, or is there something else we should focus on instead?
Yes. I would honestly say no. Like a blanket statement, I would say let's just not have everyone doing Kegels. If you want to check, and then the next thing is, you know, some people say, well, try to just even check if you can do it and you stop the flow of urine. I would even say don't practice doing that. If you're comfortable with your body in the shower, clean hands, you know, just insert a finger even a little bit, you know, and just try to see if you can squeeze around your finger and draw it up inside. Just once or twice to say, okay, hey, how am I doing? And then you have that like, oh, I can't even squeeze, or it's really super, or, ooh, that hurts. That's not coming. I kind of hit myself before I got in the right spot, and it's tender down there. You may not realize that you have that. So the vast majority of my practice is helping people relax their nervous system, release and stretch and relax their muscles. And so I would say, hands down, we need more of that than we do need, everyone squeezing and everyone tightening.
Well, and wouldn't you also say, like, having body awareness? I think there's so much shame that is taught around our reproductive organs that just having that simple body awareness can be very good for us. Yes.
Yeah. And I mean, do you cringe at the thought of, hearing me say, put your finger inside your vagina and try to squeeze around it, I have many people that would not. I mean, that's part of our treatment is I say, okay, I need you to just take a mirror and look, because they can't, relax or contract or, Yep.
So in your practice, what are some of the more common issues that people come in with that you can help with?
Yes. So I kind of tell people it's like there's two ends of the spectrum. Usually people come in with some painful condition or like a weakness. So in the painful end of the spectrum, it's like painful intercourse, abdominal pain, or just pain after having a child or with pregnancy, pain to move their bowels. Those are typically kind of some of the main pain ones. And then, I have to say there's endometriosis. There's definitely conditions that can be, painful. Interstitial cystitis. There's, anything with the bladder, any kind of pain in like the lower half of the body, hips, butt, abdomen, pelvis. Then towards the weakness end of the spectrum, prolapse, so that feeling of heaviness or like something's coming out of your vagina, like a tampon's falling out when you don't actually have a tampon in, and urinary incontinence, fecal incontinence, which means it could just be, streaks of underwear or actually pieces, streaks of poop in your underwear or pieces of poop in your underwear. It also can be if you go to the bathroom and you have a bowel movement and you wipe till you're clean, you get up and you go. The next time you go to the bathroom, all you do is pee, but when you wipe, you see more stool. So some had kind of come down and come out, like that's, on the scale of fecal incontinence. And like diastasis recti, healing the abdomen after having a baby. Although men can get diastasis recti too. It's basically anytime your abdomen, gets stretched out, or, you have that linea alba that just isn't as strong. So we can work with that. And then, hip pain, like, if there's a weakness there.
So when do you think is a good time? So if you plan on getting pregnant, when would be a good time to visit a pelvic floor physical therapist? Would it be while you are pregnant, or would it be after you have your baby, or if you're having a problem? What do you recommend? What do you think should be the norm?
Yes, I would say the norm would be like one visit, and I'm thinking about like, kind of this paradigm shift of like, you go to the dentist twice a year for your checkup just to make sure everything's okay. I would say, if you want to get pregnant, just have one visit with a pelvic PT before you're even pregnant, and actually have some people starting to come in and just proactively, let me just check my body and see how I'm doing, which is amazing because, we can catch stuff and I can say, hey, you're holding your breath, or you're not contracting or coordinating this properly, and before all the hormones kind of go crazy, getting that knowledge of your, like a baseline for your body, I think would be amazing. So I would say at least one visit before you even get pregnant, and then one visit during pregnancy, just because there's some things we can teach, and really truly it can take even like 2 visits during pregnancy of all the stuff to have them like working on to prepare for labor and delivery, to prepare for having a smoother postpartum journey. And then obviously, they can see us more if, there's pain during pregnancy or whatever. But yeah, I would definitely say even before pregnancy.
And don't you think I feel like the 6-week postpartum visit should include pelvic PT?
Yep. Absolutely.
Like,
Absolutely.
Let's see what happened. Because I think for me, the realization when I was pregnant, I kept on thinking about the push phase, right? Like I'm going to push this baby out. But I saw you before I had Avery, while I was pregnant with Avery, because I was leaking urine.
Mm-hmm.
And one of the things I remember the realization, like an aha, was like you were like, okay, you have to relax. And I'm like, what? It wasn't just about like the tension of it.
Yeah.
It was also about the relaxation piece of it, which is so
hello, especially with a pandemic, like who isn't like on heightened alert right now? Everyone's nervous system is just kind of like amped up right now. And so, but I do find, especially younger people, we're just in a stage of life where we're trying to balance a lot of things, prove ourselves at work, find a mate, find a who, like.
Well, and we live in America. Our society is very sympathetic driven. I find in my practice, and I'm sure it's the same in yours, is that people aren't aware of their parasympathetics or even how to stimulate them. How to relax is just not a focus for us, and it should be.
Right. Totally. And even, and we're very much just, work driven. We define ourselves by, what we do for our job and, getting things done. Like, I mean, I fight that every day. Like, I feel like, it's not a good day unless I've got something accomplished. I have to have a list and I have to check it off, and I fight that, but just being and it's just hard in our society, I think. And especially with cell phones. I mean, I feel so old saying that, but like, I remember before cell phones.
Technology in general, computers,
like we don't unplug.
Yeah.
Totally. So, so I tell people, like, if you get down to the cellular level with muscles, it literally, there's this like overlap. So you contract and you relax. So we all think of like, okay, if I'm leaking, things are weak. So it's like, we don't have enough overlap. We got to really bulk up that muscle, get it stronger, and then we can get some force generated. No, what can happen is, and this is again, like 90% of my practice, is people come in and their muscles are like this. They're functionally weak because they can't go anywhere. They have nowhere to pull. They're too short, they're too tight. And so I have to teach them, and it's so mind-blowing for most of my patients, it's like, they're like, wait, you're telling me to do some stretches? You're telling me I wanted you to give me Kegels and I need to have a program to do. And I'm like, yeah, you need to lie on the floor and put your legs up on a couch and, and like, just let your nervous system relax. So anyway, we have to get them back to what, like this optimal position, so that way the muscles can contract and relax. And that's why, back to the Kegel question, like most of the time, once we do this, their body knows what to do. They're not broken. Everything is fine. We just need to kind of teach them to honor their body, listen to these signs, like learn to when they need to relax, and all these symptoms that they're experiencing could be like that last ditch effort of like, the body saying, I need help, like, and so once they do relax, then they're fine. I don't need to teach them how to do a Kegel,
I love that you talked about that, because I remember when I saw you, my mind was blown that it was actually tightness was the problem. I'm like, what are you talking about?
Yes.
These muscles have to be weak. That's the problem. And I literally was like, no way.
I know.
Oh, so tell me, what's the best part about what you do?
I have to say, honestly, like when I talk to patients and they come in, whether it's the first visit or the second, or, via an email after their visit, and they'll say, I can't say some of these things to anyone. I mean, some of them, even to their partner, they're not saying, like, sharing that they have that much pain during intercourse, or they're leaking a little here and there. And, and so being able to let them like voice that, and to just be that like comfort for them, to that like safe place. I get a lot of enjoyment from that. Like, when you're working with someone and they hurt their shoulder, or they like, have plantar fasciitis from training too much too soon, it doesn't rock people to their core. Like if they can't connect with their partner, or if they, are worried if they smell like pee because they leak so much, and they're just, it's like kind of constantly on their mind. So helping with those really more intimate things, I really enjoy, and just the feedback of like, thank you so much for not laughing at me when I told you that. Thank you so much when, you understood, and you like were totally not phased, and, and it made me feel so much better, and gave me hope. And, when I hear those things, that's amazing.
I mean, I have seen you several times, and I can definitely attest to that. You're such a safe space to share those intimate things. And there's so many judgments about it, which is why people don't tell their partners, or they keep that to themselves. And it's very refreshing when you're having such an intimate issue to
Mhm.
land in a safe zone.
Yes.
Right? Because the healing can start from there,
Totally.
you know, and it's not just a physical issue. It can be very mentally exhausting
Mhm.
for a lot of women.
Yeah.
So, yes, you are such a safe space.
Oh, thank you. And just, I mean, it blows my mind even sometimes too, because I'll see people one visit and then they email me a week later and they're like, I don't feel any of that stuff I mean, they'll still come back for a checkup, but
Yeah.
sometimes they don't. Sometimes like I literally see them one time and they're like, oh yeah, you gave me those exercises. I was pain-free for the rest of my pregnancy. And then they just come back after. I mean,
Yes.
just
And
give the body what it needs.
And I think in the past, we have suffered in silence, especially as moms, the generation before us. They have just suffered in silence, and they didn't know that there was a fix. And it's amazing that there's more voices now and that people are talking about this, because you don't have to live like that.
Yeah.
And who knows, your issue could be just very easily fixed.
Yeah, exactly.
That is so hopeful. I love that.
Yeah. And I think, when was it? I think it was 2015, 2014. Around then in Georgia, we got direct access. So like anyone can just go and see you. Well, for a long time, that wasn't true for me. You could only come to see me if you had a piece of paper that your doctor signed off on, no matter what your insurance. Well, now the rules have changed. So you can just go see a physical therapist. And they still have kind of like guidelines. Yeah, like you can only see me for 3 weeks or 21 days before you have to get that signature. So these people that like I see them one visit and they're better, they don't even need to see their doctor. Like we got them better, so they didn't have to wait and go see them, pay the doctor to then get to see me. It's just
sometimes I would say doctors don't know where to refer people.
Correct.
Especially with the pelvic floor PT, because they are also, a lot of them think that these things are just normal, or, the one thing that's told to women a lot that drives me nuts is it's all in your head. You know, and these are issues, that is often the response. So I think that's wonderful that somebody, if they think that they have an issue, that they can call you and immediately access you.
Yep, exactly. It's really, it's so much nicer now. And you think of like, this is the way we're going, where older generations, they'd say, the doctor says jump, you say how high. Where now we're like, we do our own research. We look online. We kind of, we can look and even just channels like Instagram and Facebook, and, they're not even, just Google searches, but just these social media platforms, people put out such good information. And it's really nice. So you can learn a lot that way. Podcasts, are free. So that's another awesome thing. And then if you need more help, then you can get into, to see someone and, without having to check with your doctor first.
So tell everybody watching how they can work with you. Like if they have some issues, some pelvic floor issues, how can they work with you?
Okay. So my main website is to see me in person. I do offer telehealth. And so if you don't want to come see me in person, although we do follow like all the CDC guidelines and cleaning, and we have extra time in between patients now to allow us to clean and everything. So, but yeah, so renewpelvichealth.com is my clinic website, and you can actually schedule directly right on, via the scheduling tab. It's all online. And so that's one avenue. Then I also have a podcast, kumbayalpodcast.com. And so that, I know, and you were my first guest.
I don't say it just because I was interviewed on it.
I know.
Think of the episode. It's a whole series about myths of the stuff we just talked about.
Yeah. So, and that was, my dream in starting that podcast was, Western trained medicine, it's very much like, if you don't have a research study to prove something, it's like, we kind of are a little iffy about it. And I think there's, that understandably that's important. We need to have research-based medicine and evidence-based medicine, right? But there's also a lot of knowledge that's either been passed down, or you just kind of see, but, I don't have time to do a research study, and that's not my wheelhouse, right? So I wanted to gather different people and have them share their wisdom, on this podcast, and not just about physical health, but spiritual, financial, all the stuff. So, and I'll be honest, having the second baby, I've taken a little hiatus. So I want to start back up soon.
That's okay.
Yeah.
That's okay.
It's just,
We're allowed.
yeah, I have to, you know, focus on what I can do. So, yeah, so that I'll be starting up episodes again soon, hopefully. And, yeah, so there's Kumbaya podcast. And then I'm really excited to share that I have been creating a course, and I've got other, you know, courses that I'm going to continue to create. But this one is called What's Normal Down There. So, you know, just a lot cheaper than coming to see me in person, but it gives really great information that I do share with my patients. It kind of gets them used to the model that I work with in my treatments, where it's awareness, knowledge, and then action. So getting a better awareness of their body, knowledge about what they should be doing, what's normal, and then action, you know, whether I help with my hands or, you know, they know who to see. So yeah, the course kind of goes through those three with pelvic health, and yeah, so that will be coming out next week actually. And that website is amandashipleydpt.thinkific.com.
Awesome. So. And we'll link everything in the comments when I post this. We'll link your website and your podcast and the online course, so it makes it easier for everyone to find you.
Yeah, and I'm on Instagram and Facebook too. So Instagram, it's Renew Pelvic Health is both of those, and then my personal on Instagram is Dr. So like Dr. Amanda Shipley DPT. So
awesome. Thank you so much for. I really enjoyed our conversation because I think that there's so much great information that you shared.
Well, and I really just appreciate you asking me on. Honestly, I'm honored to be your first, but like, I love working with you and collaborating with you to begin with, but then just giving me a chance to share that information with people is just, it's awesome. I mean, it's just, my passion is education and prevention. And I mean, I really, really do believe this is stuff that everyone needs to know. You know, because I've treated people where they said, my grandmother taught me this, taught this to my mom, taught this to me. And I'm like, oh my God, these are like faulty, like we shouldn't be teaching our children to pee like this or what, you know.
We no longer need to suffer in silence.
Yes.
Right? Yeah. Yeah.
There's
awesome.
help and yep.
Yes, there is help. The help with Renew Pelvic.
Yeah. Excellent.
That's like a commercial.
Yeah. Excellent.
Oh, awesome. Thank you so much for joining me. And we will share all the links. And thanks again, Amanda.
Yeah, I really appreciate you, Katrina. Thank you so much.
Yes.